So, hi everyone. Now it's 4 o'clock in Ukraine. I hope you can see me, and I hope you can hear my voice. So yeah, we'll have 1 more minute for um, to understand that everything is going okay. So as I understood, I'm online while we're preparing everything. So yeah, it's really nice time, yeah, to understand that we can just sit at home, we can study, and we can share the knowledge, and it's rather good idea, really. Well, okay, so I think we can now switch to the presentation mode, and I will put myself just above in a small window so you can hear me and you will see the slides on my screen. So let me, okay, so and the coffee. Yeah, it's a really nice idea, and I would like to thank Endostar company. So if you prepared some kind of coffee or cappuccino, so please, it is really good that we can just sit at home and enjoy our study, and it's really nice idea, and I like it, to tell the truth. So while somebody is on the way and so on, let me introduce myself. So first of all, this lecture gonna be in English, so for all my English speaking friends all over the world, and in some days my friend will speak in Russian, so I will introduce him later. So as for me, I'm working 15 years already, and my practice is limited to endodontics. Well, some people say it's boring, but as for me, I really enjoy it and I like it. I also have a PhD, and I'm co-founder of Ukrainian Endodontic Society. I think someone knows about that. And also, I'm an international member of American Station Endodontics, and I'm lecturing worldwide. So, and today, when you are having a lot of practice in everyday practice, yeah, you have a lot of different nickel titanium instruments, and my requirements for nickel titanium instruments should be next ones. Yeah, so first ones, they should maintain anatomy. So I would like them um, to keep the anatomy like it is, to not distort it. Second one, they should have a resistance to cyclic fatigue and cyclic load. And as you know, that the cyclic load can due to instrument fracture, and this requirement is rather important. Also, I would like to have a whole range of sizes, and they should be not expensive in price. So um, as for me, as a for practitioner, I would like to have such nickel titanium instruments they can use in everyday practice. And you know, I was really surprised when I tried new instruments from Endostar. We call them Azure files, and I really enjoy them. And one of the interesting thing, except that they are made of alloy that is, yeah, rather interesting, heat treated and so on. So I'm not going deep in this. I was interesting that they have uh, motion, different kinds of motion. So you can use it as regular rotation. You can also use these instruments as in the reciprocating mode, and also you can use them in OTR mode. So what does it mean, OTR? It means that if your instrument have any kind of problem inside the canal. So it will, from rotation mode, it will start reciprocating, and after it will go deeper, it will continue the rotation. So these instruments you can use any kind you want in any kind of motion you like or you really prefer. And what the manufacturer gives us, three different packs, and there is a basic set, there is a big set, and there is a small set. So there are different ways depending on the difficulty of the canals, and today I would like to show you some kind of alternative. How can I use them in difficult cases? I try to use always crown down technique, and what we know is there is first way is a early coronal enlargement. So it's one way using different variable tip, and second way we can use a crown down in a single length technique. So I'm trying to combine these techniques, and let me show you first of all how I will do this using Azure files. So this is all the files that we have if we will buy all three sets. And what I do, first of all I'm taking the orifice. You know, this instrument is rather universal, I would say. And after that, from all these three sets, I'm taking instruments that have 4% of taper, and I will use them consequently. So 3504, 3004, 25, 20, and this sequence will help me to make the primary shaping. And after I reached with 2004, I reached the working length, I can confirm this length, and I should do the final shaping. So final shaping means that you need to increase the diameter of canal from 20 till 35 or 30 or 40 and so on. So I need to enlarge the canal to bigger size. Why we should do this? Because during enlargement, during cleaning and shaping, we remove a lot of biofilm, and it helps us to penetrate of sodium hypochlorite. So this is the main idea, and let me show you how can I use this in primary cases and in retreatment. So as for primary case, I have such interesting case of the lower molar, tooth number 447, and this case was referred to my office, and previous doctor was very afraid because in the two-dimensional X-ray you can see that there is a mandibular canal, that it is near the lesion. And what we've done, first of all, we've done the CT scan, and what we can see that the canal is to the vestibular aspect, and this is distal canal, and the main canal is to the lingual side. And what we can also see that at the orifice we've got three separate canals, and in the apical zone, so 1 or 2 millimeter before the apex, before the end of the canal, we can see that there are just two canals. So it gives me a lot of information, and also I can make a planning. So what would I do? First of all, I would measure the length. So for the distal canal it will be about 19 millimeters, for the mesial canals it will be about 20, and this is how it looks in the tooth, so how it looks in the mouth, yes, of this tooth. And what we can see now, we can start our shaping. We're removing the old restoration, we're finding the canals, and now what I've done in this case. So I'm using 10K file as a probe, like it will give me ability to understand how far can I go, and it gives me ability to understand the complicity of canal. So I'm getting with K file number 10 till the first slight resistant, and I manage this. I'm measuring this length, and it gives me ability to go consequently with 3504, 30, 25, and 20. So what I'm doing primary shaping, and I'm doing enlargement of cervical part and a little bit of middle part. After that, it gives ability for my 10K files to go deeper. So because you can see that the curvature is rather interesting, and it gives me ability to go further. And again, I'm putting 10K file to the first slide resistant, and I measure this length and try to go consequently first one, second, third, and fourth. So again, I have already preflared the coronal part, also middle part, and now we can go to the apical part. So after that, 10K file went to the working length, and now I can finalize my primary shaping. But as we mentioned before, 2004 is not such a big enlargement as we would like to have. That's why I need to make a final shaping, and final shaping means that I can go now with a single length technique. So now I can go to the working length with 2504, 3004, and in such a complex case, I think that for the primary shaping 3004 will be enough. If it would be retreatment, so I will go further for 35, 40, and so on. So if the canal gives you ability. And let's check the working length. You can see that the anatomy was maintained, and you can see there is no kind of transportation, and this is the final result we've done in this case. And I was really glad to achieve such a result, because I understand that these instruments can give you ability to do this case. Also, how it's look in mouth, and what also was surprised for me, and I was really enjoyed this. So I thought that I cannot use Azure file in retreatment, but I was wrong. And let me show you some cases. So for example, this is the first upper molar, and you know the main problem of them is that always MB2 system, so here will be MB2 system, is always missed, and the previous treatment was done maybe 5 or 10 years ago. So now we need to make retreatment. And when the material is not so hard, when the material is rather soft, so if we can find, for example, gutta percha and a sealer, we can use Azure file and they will be rather effective. So let me show you the palatal aspect and just take a look that Azure file just removing gutta percha quite good, and this is really nice thing. And I was surprised, really surprised, and I was glad that I can do it with the same files. This is how it looks after shaping of mesial system, distal system, and palatal. This is how it looks before the obturation, and this is the final obturation. Let I see the final result. So the final result is looking like that. And I was glad we've done this case. It's good. One more is looking again molar on the upper jaw. So this is tooth number 26. And when I was looking at this case and analyzing the preoperative X-ray, I was thinking why in the mesial system we have just a half of obturation. So palatal aspect is good, maybe just distal not bad, but mesial wide just we have a half. So I was removing the old restoration, and now what we can see here should be mesial canals, here it will be distal and palatal. And when I started shaping, I found interesting thing. So previous doctor was even he didn't find the true MB1 canal. So this gutta percha that you can see on the wall, let me go back to this case, you can see that this gutta percha is just a canal that he created. So he was making the canal just in the wall, but it was not a true canal. So true MB1 was here, and suddenly this is MB2 system, and after our full shaping and cleaning using Azure file, let me show you the result. The result is looking like this. Yeah, it's quite good. I was glad because now we found the true canal, and the prognosis of this tooth is gonna be good. Because the idea was to share some cases and not to take a lot of time. Yeah, and I'm trying to remind you that you have a coffee. What is my message? So what we can take home? Yeah. So first thing is that the instruments, they create the space for irrigant. I just need to remember this. Also, the instruments, they physically destroy biofilm. So the idea of shaping is first of all to destroy the biofilm. And if I want to remove more biofilm from the canal space, so increasing the diameter till 35 or 4 till 40 or 45, because you have them in this kit, is a good idea, and you will have more positive results after that. And don't forget that removing and enlarging, when you're enlarging the canals, you should use after each instrument sodium hypochlorite. So sodium hypochlorite is like our main solution that we used to work with, and to start working with, to have this effect of working of this solution, we should enlarge the canal at least 30. In retreatment case, more, so 35, 40, and so on. So this is the main message that I would like you to take home. And also, I think you enjoyed some coffee that you prepared. And I want to introduce our next lecturer. He's my friend, Andriy Sepelyuk, and on the 6th of April, he gonna introduce his clinical cases. And I would like to thank you for your attention. And also, if you have some questions, please, I have some time, and I can answer you. Let me just, yeah. So one question is, what about danger zones when you use 3504? Well, if you have heat-treated instruments, you are safe. So danger zones, these are zones that are really dangerous when you are using regular nickel titanium instruments, but not heat-treated, because all the time they are trying to go back to their first position. Yeah, so if you will bend them, so they will try to, we call this super elasticity, and that's why we should remember about danger zones. But when you're using instruments that had been already heat treated, there is really no problem in this, so you are safe. Good questions. How to remove the Enterococcus faecalis biofilm? Well, it's a question just for maybe for some hours for scientific work and so on. But first of all, to remove any kind of biofilm, you should remember about from perio. Yeah, you remember that the calculus that are connected to the tooth are usually removed by ultrasonic, yeah, by current, and the same thing we have in our canals. And also, I think you remember about caries. So how can we remove biofilm when we have carious lesion? The same thing, we take a turbine, we take a burr, and we physically destroy. The same thing we should do in the canal. So using enlargement, so cleaning and shaping, we are removing the biofilm, and it doesn't matter what kind of microorganisms are living there, they will be removed and eliminated. But after removing of the biofilm, certainly what you have to do is 3D obturation, not to give them ability to grow up again. So, what is your favorite movement for retreatment use? Well, when I'm working with retreatment cases, because I have maybe 99% of all my cases are retreatment. Well, I'm feeling myself good when I have regular rotation. So 360 degrees regular. It's for me it's normal. But sometimes if, for example, you feel that the material is rather hard, so you should use ultrasonic, or you can use some solvents. Chloroform is a good thing. So if you have ability to use a chloroform, it will help you to dissolve some gutta percha from the canal, and your instrument will go like in the butter. So it's not a problem. Yeah, what else? Some more cases. The file systems. Well, my so what is the cross section of the system? Well, if you will take any kind of promotion notes, you can find these details. So for me, it's not so critical now. So um, it, it's not such a question that we yeah, maybe some more questions. Yeah, anyway, we're in time, it's good. Yeah, and we can wait for some. Yeah, and usually what we say, yeah, so going to the previous question, so the cross section of the Azure file is a S cross section, so English letter S. So I think it's not such a question, like, yeah. Yeah, good question is about which agitation is more effective, sonic, ultrasonic. Well, nice question. In my opinion, ultrasonic effect in and motion in the in endodontics is the best way, but we are not excluding sonic. So I would prefer, for example, if I have a complex case, so I would prefer in a straight part ultrasonic, and in a curved part sonic. So I will use positive sides of ultrasonic and sonic together. So I'm not trying to exclude anything, and I'm not trying um, to anyway, I'm trying to increase everything that I have, not to make it like to exclude something. Okay, so one more question for today. Yeah. Anyway, we'll get the recording of this of our session, and really, I want again to thank Endostar company, and I think we spent some times, and we enjoyed some coffee. Yeah. So if you will have some more questions, you can find me in a Facebook. You can find me in Instagram. So I'm glad you can ask me any questions. So I will try. Thank you so much, and thank you for watching. And see you. Be healthy. Stay at home. And see you. Bye bye.